My first tip for postural analysis is that it takes practice. It's not something that can be learnt overnight or in a few days. It really does take time and repetition to kind of get used to looking at people and being able to see structure in a three-dimensional way. So it's not something that's going to just come overnight. So be patient with yourself and take time and just keep looking at people, keep practicing, keep looking in the bar and the restaurants whenever you're out for a night, and especially obviously with clients, be able to just take a little bit of extra time with your clients. Do that. Just don't rush into your treatment. Make sure that you give yourself time to gather some ideas for yourself during the treatment. The second tip is getting used to reading relative to something. So quite often we teach about the plumb line, and the plumb line is a useful tool, but it doesn't give all of the information about what's the relationship between the shoulder and the rib cage and the head, the rib cage and the shoulder. So it again takes a little bit of practice, but being able to see the relationships between different bones and essentially just asking yourself which two bones are closer together than they perhaps should be. So then the third and final tip is to remember that postural analysis is not a diagnosis. Postural analysis is a source of information, and it's a source of more questions. So having some other tools to be able to assess if these two bones are closer together than they should be, that's interesting information, but another question can be, can they actually move apart? So having some kind of functional assessment, some orthopedic assessment is an ideal combination along with postural analysis.